So we're here today on Radically Human Conversations with my Heath, who is a naturopathic doctor and a doula and a health rights advocate, and she works in the greater Chicago area. And I'm going to let Mai really tell us about her background and, what her passions are. And I'm just going to say that Mai and I met at a patient-centered outcomes research institute conference, and we really connected because we were listening to all these conversations, and the voice of holistic health and healing was not in the room. And so we, found each other in the hallway and started talking about that. So, Mai, please tell us more about yourself.
Yes, I'd be happy to. And so glad we did meet at that time a couple years ago now, coming up on 2 years. Thank you so much for having me here today. As you mentioned, I'm naturopathic Dr. Mai Heath. I'm a birth worker, doula, childbirth educator, and the proud founding director of In Doula Community Alliance, which is a health equity and social justice focused organization serving Cook County in Illinois. So that's the Chicagoland area. We really put our efforts and energy into, positively impacting the and influencing perceptions and policy around people's access to holistic and traditional care, especially Black birthing people and other people that find themselves marginalized within healthcare spaces, which are, a number of different groups from folks that have chronic illness to people with substance use issues and many other things. So, like I said, happy to be here and to talk about the work and how it overlaps with everyone's expertise here.
Fabulous. So I just want to start and then Jackie and John will jump in. But just for background for our audience, can you tell us about maternal and infant mortality rates in the US versus other countries, and more specifically for Black moms and babies?
Yeah, I'd be happy to do that. Like, especially for the Chicagoland area, I have lots of information. I was actually just a part of a cohort that met with a pediatrician in Georgia, and they were telling me about their rates, and it really brought to my attention that birth is so pervasive and it's everywhere, but when it comes to these statistics, it's very common and expected even to really just know about where you are. But I'll start out broad, like you had brought up, Jennifer. I have given birth 3 times. I have three girl children, and the first two were born in Toronto, Ontario. And even there, as a Black birthing person in Ontario, we would talk in community about the discrepancies, in healthcare outcomes for Black birthing people there, and just the mortality and reproduction and all of that. So even in Canada, Black birthing folks are twice as likely to die in childbirth or perinatally or up to that kind of year postpartum mark than white counterparts. But then when you move to the United States, all birthing people in the US are twice as likely to die in that perinatal time that I mentioned than someone birthing in Canada. So when I gave, in my head, I'm kind of like, gosh, I was twice as safe to deliver my first two than to deliver my third, which was born in Chicago. So that's the first part. Then when we look at the US nationally, Black birthing folks are 3 times as likely to die in that perinatal period than our white counterparts. So, you see it gets higher and higher. Then, when we look at the Chicagoland area, Black birthing people are 6 times as likely to die in that perinatal period than our white counterparts. And it's very interesting, that I keep saying white counterparts, white people, white birthing folks, because we standardize whiteness. We always have. We just like we standardize male body people, male folks. But really, it's interesting for myself and for a lot of people to know that the best birthing rates in the United States, or the best outcomes, are not actually among white birthing people. They're very close, but the best outcomes are among the Asian birthing population. So Um, the folks that have the best outcomes in the United States are Asian birthing people, then white birthing people, then Latina folks, then indigenous folks, then black folks. So, black people have the poorest maternal reproductive outcomes, but also the poorest infant mortality outcomes as well.
I have a question and it's all going to jump in. Um, Doctor, can you share with us what your perspective is to that discrepancy? A narrative around that discrepancy. Is it merely cultural practices? Are there a historical context? Is it zip code? Could you share a little bit more about what you think?
Yes, yes, and yes. And that's a question that we're always asking ourselves because we want to improve outcomes. And we have seen improvement to outcomes. We have seen improvement to outcomes. I'm most recently in the community talking about, improvements among folks that are engaged with community based supports, peer involved supports, which are largely trauma informed supports as well. So, we see some movement there. We've seen some movement positively among breast and body feeding rates, even improvements to teen pregnancy, with those steadily declining for decades, actually. And there was one other rate before I lose my thought that I wanted to share. It may come back up, but I do. I just want to highlight. Oh, well, it's the birthing out of hospital movement, kind of bringing up some of that movement that was from the 1970s. So you do at least have more options and more interest in folks not just birthing in the conventional hospital setting, but being interested in home birth, birth center birth, and other locations as well. So I want to bring up that positive movement, but to get back to your actual question, yeah, it's definitely multifaceted. Black women and birthing people, right, in the United States have always been set up to have poor birth outcomes, from you know times of enslavement, and what we were forced to endure, and how we were forced to be pregnant and to get pregnant, and all those sort of things that has set us up, and the remnants of those practices, the ideology, are still present today. And also we have to remember that we're always new people birthing new generations, so even to teach that history and the impact to our little ones, um, to prepare them or make them aware, make them informed, that also takes a toll and is not insignificant. But so anyway, so we have that history, and then also history within healthcare spaces of hesitancy around conventional providers, and engaging with providers, not having culturally reflective providers. So trust and rapport. Also, our healthcare system is not really set up for longitudinal support, especially for folks that find themselves that may need assistance, financial assistance, public aid, things like that. It's very rare to find folks that will have a relationship with a healthcare provider for decades and decades. They might be seeing a different person every time, and that does not encourage folks to keep up with their health, with their health care, with their providers, their appointments. And we know that those things weaken and put cracks in place for us to be able to take care of ourselves, to manage our stress, to take care of our families and our communities as well. So like I say, definitely multifaceted. You had mentioned about zip codes. I mean, Chicago has long been a very segregated city, so we do find concentrations of black and brown folks on the south and west side of our city. But we're uh, it's 2025. We're certainly everywhere. You'll find us, in the suburbs up north and things like that. But in the south and west side of our city are the places where we might have deserts and swamps, whether that be food and nutrition or medical deserts and swamps. So we got folks having to travel from their community. They can't give birth in their community, get appropriate care in their community, and they have to travel to another zip code where there are better resources, more progressive care, and things like that. So, and I'm sure I haven't even, that's not exhaustive. So, it's definitely multifaceted, and folks that do the work that I do, advocates and community care workers, we're always looking for, the nuances of what is going on so that we can find places to mine for success and chip and whittle away at what the challenges are and then augment what the successes are. So it's a long journey. It's a long fight.
John, you're on mute.
Doctor, I mentioned before we started, I've done jail and prison litigation. Back in the 90s, I joined a group and we sued a number of California jails for essentially an absence of care for inmates who come in who are pregnant. And, our approach was that almost all of these people were high risk and needed special attention. And I was interested in reading about the project you have going in the Cook County Jail. I've been to the Cook County Jail, and to me, when I was there a number of years ago, it didn't seem to be a place where we could mother the mother. It was a pretty tough jail. So, could you describe how that project came about and what type of cooperation you've had with the jail?
Yeah. So that's not a project that was spearheaded by Indula Community Alliance, but rather, and I don't want to get the name wrong, it was a Healthy Mothers and Babies program. Um, and I was able, had the honor of being amongst the first cohort. Now, this was some years ago. I want to say that first cohort was back in 2019. So
Okay.
I had the pleasure of being a part of that first cohort through an agency I work with as a community-based doula and home visitor. And we went into the jail, toured the jail, tried built rapport with the pregnant inmates there, and learned about their lives and experiences and their hopes and what they anticipated for their births and things like that. When it came time to support their birth experiences, one of my colleagues at the time actually supported the birth of someone who was incarcerated on site at Cook County Jail. So they delivered at Stroger, and the account, so this is a secondhand account, but the accounts that my colleague shared was really harrowing, from witnessing and supporting this person birth while handcuffed to a bed. That definitely sticks with me. So that's a secondhand account. For my personal experience in that program, I supported a number of moms, about four. They were all on house arrest in the program, so they were able to have some more freedom and a different experience than those that were birthing, that were on site, at the jail and birthing at Stroger solely. But a lot of what came up, a lot of what I learned and witnessed and supported people through were around concerns to divulge information of their health history or their current, what was going on, to their healthcare providers, because they're already in a vulnerable position and worried about child separation, worried about, hey, if I say I'm engaging in this activity, or even if it's something that isn't necessarily criminal, just like I say, being more vulnerable and not being willing, or being hesitant, being scared to share what could be and is oftentimes vital information with their providers.
All right.
Along with one other thing, it's the so I mentioned about child separation, but oh yes, if an accident or something happens to the little one, whether it be a bump or scrape or anything like that, just fear and hesitancy even to go to the hospital or the doctor, and in engaging with mandated reporters or anything like that, just out of fear of child separation. So there's definitely an added layer of vulnerability and approach to supporting incarcerated folks, or justice involved folks through birth.
Yes.
If you don't mind, I actually like to share one other thing. I was briefly the program director for a volunteer organization of birth workers here in Chicago, and we had a program um, in that organization where our coordinators actually taught some incarcerated folks via Zoom skills, tips, tricks, and the craft of being a doula birth worker so that they could actually support and prepare folks that were in early labor, that were in their unit with them, through birth. They weren't able to travel with them to provide labor and delivery support, but they were able to provide some early early labor, early, support. So that was another really exciting initiative that I was happy to be a small part of. Yeah.
Good. Thank you.
Mike, can you talk about poor access to and insufficient diversity in mental health care services and providers? Because I know when you talk about wraparound services for your own organization, that's a big part. And I think I'd love to hear more about that.
Well, I think society, I hope society is moving towards that place where we realize that mental health care is, is of equal import to physical health care, and that they really go hand in hand, and, one can influence the other, um, and vice versa. So long history of stigma and taboo around mental health. I hope and believe that that is changing as well, even though, I think that we could do more there with destigmatizing, mental health concerns and providing better supports. Culturally speaking, I mean, birth and pregnancy is a time in particular where we have this big life-changing event that can be, very stressful, where mental health supports are even more necessary, even more needed. It can be a time of increased intimate partner violence or domestic violence with other folks in your home. So it's a vulnerable time. So being able to have mental health supports is, of paramount importance. And going back to what I said in a previous comment about having culturally reflective care, to be able to build trust and rapport and be able to elicit information from folks that they might not otherwise want to share. They might share with their doula, birth worker, home visitor, auntie, mother, sister, cousin, but when it comes to their doctors, nurses, or anything like that, it can be, scary and very hard and place them in a position where they feel vulnerable. In birthing spaces, we have the Edinburgh postpartum depression scale, which is a usually about an 11 question. I have seen some versions that have more questions, but an 11 question um, scale questionnaire. It's meant to be a self screening tool. This was developed in 1989, and myself and my colleagues and many of us at Ndula have looked at the Edinburgh postpartum depression scale to say, is this really sufficient? Is it also culturally sound? Is the language that's used accessible to Black people and, other folks? Like, what are we, really learning from this? I definitely have my concerns about if it's, the best, or if it's enough for identifying depression and anxiety in birthing people. There's another one called PASS, the I don't want to get the name wrong, but it's like perinatal anxiety screening tool. It's actually from Australia. You won't see it used a lot in the United States, but it's specific to postpartum anxiety, which we know is sometimes kind of marginalized within the postpartum depression spectrum. We often look at the symptomatology or talk about the symptomatology for depression more than anxiety. But that PASS scale identifies postpartum anxiety in people more often than the Edinburgh. So even, being able to identify these, concerns, looking at, people's baseline, a lot of times we don't know what people's experience with mental health support or concern is before they enter a birthing space. So we don't know what their baseline is. They could be like, yeah, I'm always stressed, I'm always anxious, but I just thought that was normal. And I can't say that the Edinburgh really addresses that super duper well. Um, but yeah, not having enough culturally reflective supports, even being able to pay for mental health care. So there has been some renewed commitment to at least public assistance, making space to pay for mental health care, but you will still find. I just talked to folks in a program that we're running last night that was talking about barriers to getting care for mental health in particular, whether they have private insurance or public aid assistance, hoops that they have to jump to be able to get this care, or just getting bills back and it not being covered, and they're expecting for it to be covered and having a hard time or having to interrupt care. So I'm not sure if I touched on exactly where you were getting at, but those are the thoughts that I have and the concerns that I have for sure. It's important, but it should be better, more accessible, and something that we facilitate people engaging with, as opposed to just making it hard for them to access.
Oh, thank you so much for that. And I have so many thoughts going on, and I'm like, rein them in. She's so fascinating. So, where I think I want to go next is a lot of the work that I do is the food is medicine. It's about growing our own food, about learning the skills to alchemize, get in touch, really at the intersection of food, health, and earth, right? Cultural reclamation, that whole thing that is so progressive and so alternative, when it really is just getting back to basics. It really is just going back to the original ways of doing things. So I'm wondering, how do you engage individuals that really could benefit from your services, but are afraid to understand the benefits of going this route? And then how do they even pay? Do you get reimbursed? Could you share a little bit more about how your clients pay for your services?
Wow. Well, you said a lot there for sure. I mean, and it brought up a lot of things for me with what you were sharing. I wrote down a note. I said, who teaches the original ways? When we look at, divested and marginalized communities, a lot of the approach that was taken to weaken us so that we could have a hierarchy on life, you know, it was to break down our social structures, our relationships with our elders, the way that we look at our little ones and our children. So, we can't take for granted that we know the old ways. We have to take time to seek them out, listen to our elders, let our elders know when we want to listen to them, find out what they experience, take from what worked for them and make it work for us, and then also learn from their pitfalls. So that just struck me from what you said. Uh, it's just that who teaches the original ways? Are you having a system where you can learn those things and where you can pass them on too? But you were asking how people engage with our services and how they pay for our services. So I definitely hope to make that you all make our contact available and for available for your listeners. Check out our website. We have a number of different programs that we do, from community engagements and workshops that deal a lot with naturopathic supports. And we have this thing called a holistic care kit. So we're often giving out botanicals, nutraceuticals, and providing workshops around their use, their risks and benefits, their historical use and evidence around their use as well, and then resourcing the community with those items, and so that they're not just going off not necessarily knowing how to use them or things like that. So that's one of the offerings that we have. We do quite a bit of research with academic partners. We're working with one of our partners now to better define patient-centeredness through a BIPOC lens. Patient-centeredness is a poorly defined term from the 1970s that certainly didn't have Black people or marginalized folks in mind, as it was being developed. So, in order for our community to really kind of take best advantage of any opportunity for patient centeredness, or even crafting what it means, that project was developed so that we could kind of influence and inform our providers on what we really need to feel centered and feel safe, and to be able to share and divulge and to have improved outcomes. So I guess that's along advocacy measures. We also have a warm line where people can call to debrief health appointments. They can call to prepare for health appointments. There's some capacity for remote birth support within that as well. And we also recently became approved by Illinois State through SIU Medical, so that's Southern University Illinois Medical, for our doula training to be Medicaid reimbursable. So we plan to have our first cohort of trained doulas in 2026. So anyway, I was just kind of enumerating. I'm hope that's oh well, we've got our we have an arts and reproductive healing arts program called Elemental Reproductive Healing Arts, where we work on that research around better defining patient centeredness, looking at tactics to help influence the culture and climate of healthcare spaces, and then also create art together to kind of showcase to the community where we're at and our thoughts around those things. So that's another program. I don't know if I've listed them all, but those programs are by and large free to our community, free to our target demographic, which I shared, folks that are marginalized within healthcare spaces, especially Black birthing mothers. um, we welcome donations for our work and things like that. um, but we want to make this accessible, especially to Black women. And we know one of the ways is to reduce stress around financial obligations, time restrictions, also just support, having a mentor or some sort of longitudinal community support to see you through new endeavors in education or anything like that. So, yeah, by and large, they are free or donation based or sliding scale based. And we're also able to do that because we have some really amazing community partners that supply us with in kind support to kind of offset the expenses of running these things. But yeah, like, those are available. Reach out and we'll reach back pretty much.
Congratulations. Thank you.
Thank you.
Yeah, this is great. How broad your offerings are and how embedded you are in the community. I mean, these are such huge things. And I know one of the phrases that jumped out at me when I was, reading through the website was the violence prevention lens, because we know it can happen on so many levels, right? There can be physical violence in the birthing process when someone is, like, for instance, a woman who was handcuffed during her birthing process. But I mean, it happens even in a regular hospital setting, which is why, so many moms are looking into alternative settings. But then it happens at that psychological level, right? When needs are not acknowledged, at that kind of psychic level where, one's identity or culture is not really woven in, and in that spiritual level too, where there's, if somebody in a healing moment feels erased, that's a spiritual wound, and that's very disruptive. And if it's happening at the moment that a child is coming to the world, it's, then it becomes an intergenerational spiritual harm. So I just want to acknowledge all that and let you speak on that.
Yeah, thanks for acknowledging that. I was just co-signing like all of that. Yes, yes, and yes. That is in large part my take on the situation as well. Violence prevention was a term that I think I first heard when I first became a community-based birth worker. I had been a private practice doula in Toronto and even in the States for 5 years prior to having a community based focus for birth work. And that violence prevention and learning about it, and saying like, oh wow, there's a through line to birth work here. I can't say that my coworkers and I talked about that a lot. It was just, that was one of the values of the organization that we were working for. But I seeing the birth experience as an opportunity to create a solid foundation for a family unit and thus, a community, seeing the birth experience as an opportunity for positive regard, seeing it as an opportunity for positive memories that families can look back on during negative times. That in large part, spoke violence prevention to me, and also, got me thinking, well, if that's the case and if we can apply that framework, then how are we looking at, adverse childhood experiences or adverse experiences, period, when we're looking at birth? And are the conventional measures, the doctors, the nurses, the DOs, and whoever else, are they protective factors for violence prevention in families, or are they causing harm, and putting barriers to that and actually adding more stress that can lead to heightened experiences that can put birthing people at risk, little ones, babies at risk, our elderly at risk, and and other groups that find themselves vulnerable. So definitely, I see birth work as violence prevention. I see breast and body feeding as food sovereignty. I see all of that, and yeah, for sure. And some of the language that has emerged in recent years, along some of those that you were saying, Jennifer, about experiences people having in birth are, obstetrical abuse. We now talk about obstetrical abuse more, or even medical coercion, those things. And definitely psychic, metaphysical, spiritual harm can be caused, and don't necessarily get the rightful recognition of the impact of those occurrences, and then who's left to carry the the wound, who's left to carry the hurt, the harm, the slight, but those people that are most vulnerable and who went into spaces to be cared for, and treated otherwise. So um at Indula, we kind of try to deal with the problem at both ends, candle burning at both ends or whatnot. So we're often providing technical assistance and support and consultation to medical institutions, birthing spaces, to try to change that culture and climate within those spaces, but then also coming from the end of resourcing the community, resourcing the families and the birthing people, so that they can better advocate for themselves, so that they know what they can expect, or they should be able to expect, or what they want to request, what other folks have access to, whether it be locally or distally. And also doing the work of healing justice, under so it's social. I kind of look at social justice as the big umbrella, and there's so many facets of justice within social justice, including reproductive sexual justice, but also healing justice, which I see in doula really emerging into that space even more. Healing justice was a term that was coined not long ago, somewhere around 2015 or so, by a group in Atlanta. I wish I had their name at the tip of my tongue. I feel like it might be the Soul Kitchen, and forgive me if I'm wrong. But regardless, I really just share all that to give acknowledgement to those advocates in the Atlanta area, but also just to say how new this term is, healing justice, and the way that I understand it, paraphrasing, but the way that I understand it and we use it in doula is looking at our ancestral ways of healing. So looking back at tradition, ways that we have overcome oppression, and then using those, keeping those alive, but also reimagining them in a way that's more inclusive, and that's just more impactful to where we are today. And so I love that facet of social justice, healing justice, and we do a lot of work there so that people have more access, but more just being around a space where they can heal from some of those energetic spiritual wounds that may be caused. But like I say, also trying to work with systems so that they can cause less of that harm.
I want to change the topic slightly and ask you about art. You mentioned art, and I saw it on the website and your poetry. How, how do you believe that's best to try to integrate someone's artistic abilities or concerns with the daily challenges of their work? What would your
Yeah,
advice what would your
that
advice be about that?
That is such a fun and great question. Thank you for asking it. We actually had a cohort last night with Elemental, one of our sessions, and one of our ensemble members said, advocacy artified, and I was like, yeah, I'm feeling that. I have a also a background even before my science and medical background of naturopathic medical school. Before that, I studied theater and I studied directing, which has really kind of moved me into like this producer kind of like that. We produce a lot of things, and I was able to gain a lot of skills in my education as an artist that have been able to inform that. But anyway, I see art as a way to innovate each and every system that we have. Healthcare system, farming system, environment. It is a avenue for creativity, and we need creativity to innovate these systems, these frameworks. We need to continue to grow and remember that all the things that are set in place, whether it be a building, a car, that was developed by a human being. Whether we observed nature, we observed, our own thoughts and hopes and wishes. But if these amazing things have been created by humans, even us sitting here today, we can create new and amazing things, even if that's ways of thinking about things. So I really do love Elemental Reproductive Healing Arts program. It was not the very first program that we launched at Ndula, but it was the very first program that we ideated. And it came about because so many of us were experiencing violence in our workplaces, like emotional violence, lateral violence, things like that. And we wanted just to have a space that was safe and a space where we could kind of exercise some of those wounds, or, kind of reframe narratives and heal from those spaces. So, or for those experiences. So, what I would say, we do a number of, improv activities. We do a number, which improv was first created as a healing tool, a health and healing tool. But we do creative writing activities, and all centered around these health advocacy tactics that we've been developing to help us better define patient centeredness. So anyway, to get closer to the heart of your question, whether it be finding these activities to do in your daily life, maybe thinking about some different creative writing prompts or looking them up, or engaging in play, just period. Like, it doesn't even have to be that prescriptive, but engaging with play with those in your community, those in your loved ones, friends and family, and remembering what it was like to be little and envisioning what you want to have as you grow older. That's how I think that you can create space for bringing that art and creativity into your life, even despite work obligations and family obligations, and then looking to see how that informs and transforms where you are, and how you can bring that to your work, how you can bring that to your professional life and your personal life, or reach out to a group of people. This is ensemble work too. We don't do this in isolation. Reach out to a group of folks. You can certainly reach out to us, and we'd be happy to share, or share or guide how art might be able to be used by you in a beneficial way.
Thank you.
So I would love, like, what I'm hearing, the theme is that joy, that peace, that safety, that security, that being seen, that respect. And what I'm hearing also is like bringing that village together again, right? To help and center the mother and her health, her psycho-spiritual, emotional health through this process, and really transmuting that experience of labor and birth to really bring back the magnificence and the beauty and the spiritual connection of what that is. So I'm wondering, do you engage like the family? Are fathers involved, or are there generational opportunities for the family to be involved?
Are you meaning specifically to elemental program, or to Ndula offerings as a whole?
Oh, well, either or.
Well, yes, definitely, and yes. I mean, we take a multi-generational approach to our work. Um, we will always, have space for little ones to be around. We usually have childcare provided at our community engagement events, at our rehearsal sessions for elemental, or anything like that. And like I say, engaging the little ones, taking a multi-generational approach. Um, sorry, I'm like, what else did I want to say? I kind of lost my thought. I'm human. I lose my thoughts sometimes. But you were asking about fathers and partners, definitely, definitely, because so thinking about social determinants of health, like at Indula, we really try to look at the community as a caregiver. Like the community, not just the people that make up the community, which really is the community, right? Not marginalizing the humans and the people, but also like the services in your neighborhood or in your community, the what resources, where can you get food there, what's transportation like, you got somebody selling, paletas on the corner, or what's going on. We look at that whole microorganism as like a vessel for sustainability, a vessel for justice and things like that. So we always include and make space and welcome and try to facilitate, whether it be fathers and partners, aunties, uncles, cousins, or just community leaders. Definitely. We have a large focus on care workers. So part of our mission is not just to target and support those hit hardest by the Black maternal health crisis, but also community care workers. So I think that kind of goes into that idea and that ecosystem as well. Um, Oh man. I feel like there was something else that I wanted to share along those lines, but definitely all is welcome. We also find new ways to make space, if we have it, if it's like, hey, this is a space that I need, or I need this sort of language diversity here, or language justice here, or accessibility, justice here, then it's like, okay, let's create space. More is more for us over here. It's a community that we're building. It's an ecosystem, and definitely we do. I will then follow that up by saying, we do center um, Black and BIPOC birthing people, like Black women are for sure centered, um and this is a space where we so often care for others, so it's a space where we get to continue to care for others, but we are also seen and heard and cared for as well, and we're discovering together what we need in order to feel cared for, as that continues to evolve. But yeah.
Mike, can I ask about, you mentioned the community, and I'm really interested if Endula Community Alliance has had any role in environmental justice, environmental health. We know that contaminants and pollutants and, water, soil, air, all of these things are really detrimental to the health of mothers and babies. And I'm wondering, certainly, there are cities all over the US that have infrastructure that is toxic itself, whether that be lead pipes, a variety of issues. So, can you talk a little bit about whether you all have had any engagement with those issues?
Yes, and not as much as I'd like, but I feel like where we put our foot forward is being an example, role modeling. So, the first thing that came to mind was just how much more detrimental to the environment hospital births are, surgical births or C-section births are to, to the environment than, home birth or low intervention births are. And definitely being an advocate for, helping people to access them. We're giving them information so that they can make an informed decision, because where we're at now, even with this kind of resurgence of home birth, it's also like, okay, helping to dispel myths, helping to answer questions, because a lot of people, they're on the fence, or they've been, told by family like, oh, that's not safe, that's backwards, that's backwoods, we're in the future now, those sort of things, but trying to kind of reframe and re-educate and give people a more neutral understanding of what their options are, so that they can really make an informed decision that's less, influenced by bias. So that's, one way that we try to role model and support environmental health in that way. And then the other is being the example of, reducing waste. I know that many see like recycling and things like that as kind of farcical, that it the the benefit is, fractional to the harm that is caused by, overconsumption, overproduction. So I know, and that's a personal value that I hold and our family tries to exhibit. So I definitely bring it to Ndula. We try to avoid using single use items. We try to avoid just putting our money in places that we know it's going to directly harm the environment, and just trying to make choices that will you know set an example for the little ones that are always around, and hopefully just put us in the right direction. So not as much, but that does not mean, like I say, that birth is, you mentioned it as well, just with little ones and birthing people being so vulnerable to pollution and issues with the earth, but um, just trying to trying to put our best foot forward in that respect, and like I say, make it accessible to people and speak about it more. So not as much, but I know that it's tied. I know that it's tied with just the amount of waste that's produced from high intervention birth. Yeah.
Well, then my next question is, I'm very excited to hear. I'm inspired, I'm encouraged, and just hearing about what so much other work is going on all over really just kind of solidifies that we're on the right path. So what's exciting you these days? What innovations are making you, fueling you to continue to go forward with your mission?
Mm, that's a good question. I think it's the health and healing that I see from the people, that are core to our community. The opportunities that they have to talk about things that they didn't have space to talk about before, to dispel taboos, just getting the feedback from those people. And I mean, we're a small org. But we have a strong and a deep impact with those who we support. And of course, we'd like to reach even more people, and I see us moving in that way, especially with our upcoming initiatives. But regardless of the numbers or the quantity, having quality of impact and a deep impact for the families and the communities that we do engage with, and like I say, hearing their feedback and their success stories, is amazing. Right now on our team, we have a young lady who started out in our mentorship program, which our mentorship program, I don't think I mentioned that earlier, but our mentorship program was started with the intention to support, of course, marginalized folks, but to support people in birth work and healthcare work, especially female identifying people, and especially people of color, because there's a lot of attrition in higher education among Black women, because they don't have mentors, they don't have culturally reflective opportunities, internships, things like that. And so just keeping that in mind, like that context. So with this young person, they kind of came in through the mentorship program. They really got involved with the work that we do. They're on our staff and our committees, and they are a new a student in their first year at a naturopathic medical school here in the Midwest. And I always make that pledge, like, hey, you know that you have our support. When it comes to studying, when it comes to like whatever it is, because of course we want to see you be successful, and we know that what you need in order to be successful will continue to evolve, but we'll be here as that evolves. So it's like that's the kind of stuff that keeps me excited. This whole idea of um, increasing the number of culturally reflective birth workers serving Cook County. We certainly need more Black doulas. We need more Spanish speaking doulas, and we need more nuanced doulas. We need more, queer doulas. We need more disabled doulas. All these sort of, we need to diversify the vocation so that we have a workforce that's ready and prime to support families as they grow. So being a small part of that growth, that gets me jazzed. Being able to blend art and science and find space for myself to find peace and calm, while continuing to do this work, that gets me jazzed. So that's where I'm at with
Oh,
that.
thank you.
Maya, I just want to thank you. I'm so honored that you came to talk with us. You're like doing the work of like a dozen people. You're like this dynamo out there making change in the world. It's really, so inspiring and impressive. I just really love that we met and that we've stayed in touch and that, I consider you a great friend and colleague. And so I just want to thank you because this, when we talk about what it is to be radically human, well, you know, that, we become our most radically human self at birth, right? So
Mm.
so I think this is such an important conversation. There's no way we can talk about being radically human without talking about the birthing process. So I just want to give you, my most sincere gratitude for coming talking with us today.
Thank you again so much for having me. It's so nice to meet all of you. And Jennifer, yes, I'm so grateful that we did meet you. I remember I heard you get on the mic and you brought up a point about biomedical supremacy. And I was like, I don't know that term. And I tracked you down and we talked, and I was like, oh, that's what we're experiencing, this marginalization of well, for me specifically, naturopathic care within this, conventional healthcare system. And coming from a place that had licensure for naturopathic care in Toronto and then moving to a state that does not have licensure, though it has an accredited academic institution that, so we're producing naturopathic doctors in Illinois, but there is no state exam for them to take so that they can actually fully practice here. But anyway, all that, you put a name to something that I knew, I was experiencing. So anyway, it's been a great conversation. There's still so many more places that we can go. And so I certainly look forward to our next conversation. And thank you for having a space, for all of you, for having a space and a platform to share these sort of ideas. Yeah.
Thank you,
Thank
doctor.
you.
We really appreciate it. Thank you.
Thank you.